Aloha, gang. Dr. Russ Rosen here, and we are live. We are live with today's masterclass. I got to move this over here and turn my phone ringer off so we don't get bothered by that, and apparently do that too. All right, so I'm Dr. Russ Rosen. I help natural healthcare providers just like you thrive in a care versus care true optimal health model so your patients happily stay, pay, and refer for a lifetime. If you're finding value in this information and you want to go deeper, you can go into the club where we'll be diving way deeper into some of these subjects, which I'll be showing you right now. And if so, just put in the comment section below club, and I will send you a link for a free month. Okay, so and let me see, I should be able to see this over here. I'm going to write a comment, which is, let me know if you are with me live. And of course, if you have questions, if you have questions now, you can go ahead and put those in, and I will address those. Ian, welcome aboard as always. And if you are watching this as the replay and you have questions, go ahead and put them in the comment section, and I will help in any way that I can. All right, so today is mastering the patient examination. We want to boost your confidence. We want to boost the patient's confidence, and I want to boost your referrals during the examination. And I'm going to show you the 3 steps to my examination of how we do things. Now, we talked about in the consultation last week, that in visit 1, and so many of the management companies out there talk about, like during the exam, you're going to put a recorder on it and say, so I'm going to be recording now, in essence, getting them to be quiet so you can just do your exam, so you can then go over your findings with them in the report of findings. I disagree with that 100%. In my world, now's the time to teach you. Remember, from the neuroscience of communications, Dr. Rump, aloha, howdy. From the neuroscience of communications, I want to be able to teach you under the radar by drawing your story out of you. Remember that from last time, by applying my story to your story, by asking Socratic questions, and by using stories and metaphors. Dr. Rump right there, king of stories and metaphors. Okay, so 3 pieces. I gotta move this here, good, and I gotta move this here, great. So what I know is that obviously you want your patients to get it so they happily stay, pay, and refer for a lifetime. But during the examination, there's so many challenges. How much time should I spend? I don't want to spend too much time, but if I spend too much time, oftentimes they'll drool, right? I cause them to go into overwhelm and they don't get anything and they got to go home and think about it. Or if I don't spend enough time with them, they don't get anything and they got to go home and think about it. And so many of us have a challenge of just getting them to get it, the bigger picture of what we do. So, in our world, we're helping people get healthy and stay healthy and have the best life possible, not just feel better, but actually resolve their issues, get healthy, stay healthy, best life possible. And to get them to get this, it begins in the consultation. It begins in the examination. This is where we're teaching them how to do this, right? How we do this for them. Again, as far as, just doing the exam and then, trying to tell them what you got from the exam later, I disagree with it 100%. Now is the time to really help them understand. When they come back to the report of findings, I want to be taking their order instead of trying to sell them. There's a real difference between the two. In the report of findings, we'll be talking about that. Okay, so just for fun, because my best friend ChatGPT, I said, what did I ask? I forget. What do you want to accomplish during the examination, with your patient? And here's what old Chat said: you want a holistic, from the exam, we can get a holistic understanding. A comprehensive assessment provides a holistic view of the patient's health. It considers physical, mental, and social factors, we would put in emotional also, that might be contributing to their condition. Check. Yep. In our world, natural healthcare providers, we absolutely should be doing that. Early detection. Come on, that's our wheelhouse, right? That's our wheelhouse. If we do a good examination, we can detect all kinds of things that might be coming up soon. Preventative care. Again, that's what we do. Preventative care. We're not waiting until they have symptoms or waiting until they're sick and then trying to mask those symptoms, right? This is our wheelhouse. Now, in theory, medical world would be doing the same thing. The reality is not as much. Well, no, they do. That's just not what the medical world does. And again, thank God for what they do. It's just not this. Um, they say, chat says personalized treatment or care plans, obviously, building trust, obviously, legal and ethical responsibilities, yes, and continuity of care. Look, the reality is, if you don't do a great examination and you don't have a great baseline, aloha, Gabriel, good to see you. So glad you're jumping aboard, my friend. If you don't have a great baseline, how are you going to do reevaluations and re-reports, which is the Achilles heel of most natural healthcare providers? Most all of us, chiropractor, naturopath, osteopath, holistic medical doctor, we don't do really well at that. And that's because we never really did an evaluation that really helped clarify the truth about what's going on with them. Again, if you're doing chiropractic and you're doing subluxation, you need to do an examination that's going to prove to you and them that they have subluxations and how you're going to monitor that process over time. If you're doing brain-based, they have it and you're going to monitor it. If you're doing spit, pee, and poop tests, if you're doing blood work, if you're doing functional medicine, if you're doing, like, it depends on what you're doing, but you've got to be able to really clarify that they have what you help with and that you can show over time that they're actually getting better. Dr. Miguel here for a refresher. Love it. That is why you are so successful, because you're always refreshing. You're always learning and relearning. Good for you, brother. Good to see you here. Okay, so those are things that chat said. What I want to add is that this is the time to really educate them. Once I have, like, we showed in the consult places that we were going to educate them. Remember, every single time they stop talking, we educate them by applying our story to their story instead of trying to cram it down their throat. As far as the examination, this is where we educate them. This is where they learn about what we can actually do for them, how we can help them get healthy and stay healthy and have the best life possible. So let's jump in. 3 steps. There are 3 steps. And obviously, this one I won't be getting done in 10 minutes either. Okay, so 3 steps. The first step in the examination is before I get my hands on them. So I'm going to go from the consult, I'm going to transition into the examination, and I'm going to be very clear about what I do and what I'm looking for. So when I find that, they know they're in the right place. So let's assume you're a chiropractor and you're looking for subluxation. They need to be very clear about what a subluxation is. So I'm going to give them a 30-second wrap on the nervous system and what a subluxation is. And if they have a subluxation, I can help, etc. And we talked about that in the consult. And now I'm going to be very clear. That's what a subluxation is. And I'm going to go find it. So when I get my hands on them in step 2 and I find it in the first couple of seconds, they know they're in the right place. Okay. Now, the second thing I'm going to do is I'm going to let them know right now. Remember in the consult, I said that we were going to relieve their concerns and fears. I don't think we went into detail, but there are 4 fears, right? You're going to string me along. You're not going to help me. You're going to cost me a fortune. And, you're not going to be able to really help me resolve my issues. And you're going to hurt me. So right before we already handled those first 3 in the consult. Now in the exam, before I touch them, I'm going to let them know that I'm going to be touching them and I'm not going to be hurting them. Okay, so you got to make sure they know that before, or they're stuck in their amygdala. And if they're stuck in their amygdala, they're not sending information past the reptilian brain of the neocortex for thinking, reasoning, and problem solving. And there we are. It's not making it to the limbic system. We don't have Rosenites. Okay. And then I'm going to touch their chief complaint. So I'm going to touch their chief complaint unless it's an eyeball or a genital. No fair touching eyeballs or genitals. You get in trouble for that. But if they say, I have elbow pain right there, I'm going to say, oh, right there. And then I'm going to move into my exam. We talked about that in the console too. Just a quick touch so that they know you know. But I'm going to touch their chief complaint. Now, my question to you is, as a chiropractor, if you're a chiropractor, if somebody had a headache that went here to there, does palpating this give you any real clinical information? And the answer is no, it doesn't, right? It's coming from a subluxation right here. But I need them to know that I know. So I'm going to say, where does your head hurt? They're going to say right there. And I'm going to say right there. And they'll say yes. And then I'm going to move into part two, which is the hands-on part of the examination. Okay. So now part two. Now, we're going to touch on this in the club. I'm going to go into extreme detail about every aspect of this. We'll spend probably 30 minutes on this next piece right here, which is how do I actually do the hands-on part? So you're either a hands-on doctor or you're talking with them kind of practitioner. So you're either going to touch the person or touch on the subject, right? So you might be talking about, and a lot of people that I coach do like remote work. So they're doing, functional medicine. So you're going to touch on their subject, okay? I'll go into more detail in the club on that. But for this right here, I'm going to talk about if you were, say, hands-on. So let's just say if you're a chiropractor and you're looking for a subluxation, we're going to use this phrase. Oftentimes, if you have a subluxation causing blank, we'd expect to see blank, and that would make sense because blank. Wow, I think we may have found the underlying cause of your problem, and that would make sense because blank. So it's really simple. Oftentimes, if you have a subluxation, and I'm going to be palpating, so I'm going to touch here, and then I'm going to palpate here, and I'm going to go oftentimes, if you have a subluxation causing these kinds of headaches, touch it right here, I would find a tender spot there. Is it tender there? Yes. I think we may have found the underlying cause of your problem. And that would make sense because this nerve literally goes from here to there. So if you have a subluxation here, it could be causing the pain you have right there. Simple. Do you see how simple that is? Now I need to make that picture bigger, right? Knee bone's connected to the hip bone's connected to the universe. I need them to now start to get a bigger and better understanding of what we do. So I'm going to look at motor, sensory, and autonomic. So here, sensory would be headache. It would also be pain along the greater or lesser occipital nerve, right? They could, like when they brush their hair, it feels like a sunburn or they got bit by a mosquito or a spider or something like that. It burns a little bit right there. Really not going to talk motor here. So motor is more brachial plexus and lumbosacral plexus. So I would say, do you have any numbness, tingling, pain, weakness? So sensory and motor down your shoulder, elbow, arm, hand, fingers, or down your, leg, hip, buttock, knee, ankle, foot, down your leg. So we're looking at motor, sensory, autonomic, and we're looking at motor and sensory and autonomic. So oftentimes, if you do have a subluxation causing these kinds of headaches, we might find a tender spot there. Is it tender there? Yes. I think we may have found the underlying cause of your problem, and it would make sense because this nerve goes to there. Oh, interesting. Now, do you ever get any pain or tenderness along here? I do. Well, that would make sense because that nerve literally goes to there. Okay, so now I'm going to go to autonomic. Now we've got this, do you have a back problem or a health problem? It has our whole story on back, the chiropractic premise there. Again, if you're doing acupuncture and naturopathy, you would put your premise there. And then there's the Merrick chart right here, which has some very specific things in there that I love. And I'm literally going to go, so oftentimes if you do have a subluxation here causing these kinds of headaches, they now know they're in the right place and I can help them. Do you also get spaciness, dizziness, mood swings, brain fog, eyes, ears, nose, throat, sinus issues, ADD, ADHD? Did you ever get any of that? So I'm going to have them put this on a clipboard with a pen, right? And they're going to circle their chief complaint. They're going to circle C1. They're going to underline, I do get sinus issues and I get throat issues. Well, again, that would make sense because this nerve doesn't just go to here, but it affects all of this, right? It affects all of this right here. So now they see the connection and they're starting to go, wow, there's more to it. So now I just go through the rest of the spine and I connect all of the dots with motor, sensory, and autonomic all the way through here. Again, I'm going to go through way more detail in the club on Thursday. Again, if you want to join, just put club in the comment section and I will get you a free month in there. But it's a live Zoom class where we're actually talking. And depending upon the style of work you do, if you're doing brain based or you're doing, subluxation based, or you're doing functional medicine, I'll help you figure out how you do this in your world. But the phrase is going to be the same. I coach all kinds of different practitioners. The phrase, oftentimes, if you have a subluxation or brain lesion or a lesion or a brain imbalance or a congested organ or a nutritional deficiency or whatever, we would expect to see, is that going on with you? Well, that would make sense because that's always the same. It doesn't matter. We just got to translate it for how you work. We're also going to talk about their lifestyle, right? So we're going to start to get them see that, are you doing, tell me about, your exercise. Oh, you golf all the time. Are you doing cross training of any type? We're going to look at their 3 dimensions of stress we talked about in the consultation. So, wow, no wonder you're in the shape you're in. When I find subluxations in this area, oftentimes we've got a real poor diet, right? So I'm going to connect their lifestyle to their spine and nervous system, to their acupuncture points, to their tongue diagnosis, to their iridology, to their foot reflexes, to whatever it is that you do. I'm going to connect all of these, and then I'm going to prove my case. So I'm going to prove my case, and oftentimes if you do have subluxation causing headaches, sinus problems, mid-back pain, indigestion, low back pain, constipation, pain down your leg, diarrhea, PMS, bladder control issues, whatever they have going on, we may also see and then make it make sense to their lifestyle. And then we may also see limited range of motion, and that would make sense because posture, and that would make sense because brain imbalances on your neuroinfinity scan, and that would make sense because cellular toxicity, metabolism issues on our spit, pee, and poop test, that would make sense because on your x-ray, and that would make sense because, right? So we're going to get very, very clear in the club on this aspect. We'll probably spend at least 30 minutes on this one point, but that's something you can start to play with right now. Oftentimes, if you have we'll call it subluxation causing this kind of headache, we would expect to see, is that going on with you? Well, that would make sense because motor, sensory, autonomic, lifestyle, 3 dimensions of stress, prove your case. Those are the things that we're going to touch on. Now, in the end of the examination, they're going to say out loud, we're going to use the whole story. And again, if you want this right here, I'll be giving it in the club, so you're welcome to go ahead and get it in there. But we've got the whole story where they literally are going to say out loud, I know where my subluxations are. Remember, they just took a pen and circled them. So we know where they are, there, and there, that could be causing this, this, and this. I know what brought them on, right? Crack cocaine, sold the circus, raised by wolves, hit by a truck, right? I know what brought them on. I know what happens if I don't get them taken care of. I know what happens if I do get them taken care of, feel better, prevent problems, reverse the effects of the aging process, or be healthier in 5 years than I am right now and have a better life. I could have a better life. And then I'm just going to ask them, so you tell me, neck pain, headache, sinus problems, indigestion, coated tongue, stinky armpits, explosive diarrhea. Is that just a back problem or a health problem? Is that just a back problem or a health problem? And I have just taught them a lot of information, right? And it happens in moments. This whole thing can happen in 3 or 4 minutes. It's very, very fast, but they will experience it. And you're doing it right if you hear, why didn't anyone ever tell me this before? Like, how come no one ever told me this? This is absolutely amazing. I had no idea you could help me in so many ways. Okay, now just for fun, referrals. Can you imagine if you had this and you did this with them and they just said, yeah, this is a health problem, not a back problem. And you said, by now, people get it's a health problem, not a back problem. And people always ask me if they have extra ones of these. So I have ones for infants, I have ones for children, and I have ones for adults. How many would you like? Right? Tell them to go through this with their family tonight and fill them out. Kids should have zero symptoms. If they do, they got problems, right? I mean, adults too, but most adults are going to have some things. But man, if the kids do, they're made out of rubber. They're so easy to get this stuff taken care of. Okay. And then in step 3, what I'm going to do, it's really simple, is I'm going to transition out of the examination. I'm going to transition out of the examination. So I just spent a few minutes. I helped them experience that. I just went through the whole story and they got it. Now I'm just going to, I'm going to adjust them or not, right? If you have a bunch of tests, neuroinfinity, X-rays, substation, etc., you may not want to touch them and adjust them until you've been through that and go through the report of findings. If you don't have those, you may want to adjust them right now, or you may want to anyway. In my world, I want to be very clear. I'm not going to say, let's see if I can get that feeling better. I'm going to say, if you're okay with it, I'd like to go ahead and adjust you. I'd like to go ahead and do a session, whatever it is that you do, so that I can see how you respond. Everybody responds at a different rate. And what I'd like to do is do a session, then check you, and then when you come back, and then I can come up with a care plan that's really going to make sense for you. I can give you more accurate prognosis. Okay, I'm going to give very clear direction on our next visit. We're going to do these 4 things, right? We're going to go over what's going on, can we help, how long will it take, and what will it cost. And on your next visit, I'm going to suggest you bring your spouse, and here's why. Okay, and again, there's a whole lot to all of that, but those are really the 3 steps. So step 1 is just make sure they know what you're going to look for. I'm going to look for a subluxation, what a subluxation is, or congestion of chi, or brain imbalance, or whatever. I'm not going to hurt you and touch it, okay, unless it's an eyeball or a genital. Do your touch, tell, ask, teach, and whole story, and then you're going to transition out. You may adjust them or not. You're going to give direction of what's going to happen on the next visit, and then you're going to talk with them about bringing their spouse in. So here's the deal. Yeah, if you're interested, thanks, Jan. If you're interested in the club, just go ahead in the comment section below and put club, and I will send you a link for a free month. At this moment, it's $47 a month. After that, I guarantee you 100% positively, no question, when you get in there, and if you're doing the live calls with me, there's nothing bang for the buck you can get for $47 a month. In the next couple of weeks, it's going up. So yeah, if you want, now's the time. But you will have a free month. You can go in there. You could jump in on Thursday. On this call, you can go through our old master classes that we've already done, where we've already gone into more detail. And I have a whole lot of other stuff in there. So I hope that you found value. Next week, we'll be doing the report of findings in our masterclass, the first part of 3 parts of a report of findings. Again, if you have any questions, I want you to post those, and I will get back. I'll comment on those. If you want to be in the club, get a free month, put club, and I'll send you a link to the club. And I think that's it. So hope that helps. As always, much love and aloha. Bye, gang.